Hey, thank you everyone for joining us here today. My name's Mason. I'm one of the lead facilitators of REC Group, an online ketamine peer support group for people affected by ketamine addiction. You can find out more or join us to our WhatsApp community by going to the recgroup.org. So I decided to organise this webinar for a few reasons. One being that ketamine recovery spaces are plagued with misinformation, and two, because finding a urologist who is ketamine aware is still a postcode lottery, and even then the time to ask them questions is often extremely limited. So I'm hoping today can provide some insight for people. Earlier in the year, we put out a survey to see what people would ask a ketamine aware urologist if they got the chance, and today some of those questions will be answered. So I must be clear that this webinar is intended for general education only. While Dr. Belal will be sharing his expertise and answering general questions about ketamine-associated urinary tract disease, the discussion cannot replace an individual medical assessment, diagnosis, or personalised medical advice. Everyone's situation is different, so if you have concerns about your own health or treatment, please speak to your own healthcare professional or specialist. For today's webinar, myself and Abby from REC Group have selected a number of your questions received in the survey in advance. The questions were chosen because they were either the questions that were most frequently asked by the community or the ones that we felt where the answers would provide the greatest value. We'll work through these questions first, and then with any remaining time, we'll open the floor for a live Q&A session. To help everything run smoothly, all participants will remain muted throughout the webinar, and then the chat feature will be disabled. When we reach the live Q&A, the chat feature will be turned on, and you will be welcome to submit your questions for Dr. Belal to select. The session is being recorded. If you do not want to be recorded, please make sure your camera is off and consider changing your display name. So to introduce Dr. Mohammed Belal, Dr. Belal is a consultant urological surgeon at Queen Elizabeth Hospital in Birmingham, with a specialist interest in ketamine-associated urinary tract disease. He's the first author of the British Association of Urological Surgeons consensus statements on the management of ketamine uropathy, which provide national guidance to support clinicians caring for people affected by ketamine urinary tract damage. I'm incredibly grateful that he's agreed to join us today to share his knowledge and experience and help us better understand this condition and answer some of the questions from our community. On behalf of everyone joining us this evening, thank you so much for giving your time today. Welcome, Dr. Mo Belal.
Thank you so much, Mason, for kindly inviting me. I think part of the reason coming here is such an important area, and I'm obviously very passionate about this because I think it's a real tragedy. Essentially it's affecting young people who should be in the prime of their lives with this terrible problem that I have with ketamine. And so thank you very kindly for inviting me, Mason.
Thank you. If you could begin by just giving a bit of a brief overview of what ketamine does to the bladder and urinary system, please, Mo.
Yeah, no, sure, Mason. So the first thing is ketamine is actually a fantastic drug that's used in medicine. So it's a drug that's actually was designed some time ago, but we use it in clinical practice all the time, and it's actually a very good analgesic. And so traditionally it was used as an anesthetic agent, and it's still used as an anesthetic agent, and we still use it, for example, for severe pain, for burns. It's one of the few anesthetic agents that maintains your blood pressure out in the community. And so it does have a lot of medically licensed use. And in fact, they've started using it for refractory depression as well. So it's actually a very useful drug when you use it under medical conditions. Now, with all drugs, what tends to happen is they get processed by the liver and they get broken down by the liver and they get excreted in the kidneys, which then go down to the bladder. And so the bladder is really a reservoir, and it's a low pressure reservoir, which is really important. So the breakdown products of ketamine get broken down to norketamine, which then get excreted in the bladder, and they kind of get concentrated in the bladder. And what happens is it's very much dose related. So the more you take, the more likely it is to affect the bladder. And so the first thing it does, it causes an inflammation of the bladder. And that inflammation essentially allows the bladder to become leaky. And the issue with that is urine's corrosive, even without the ketamine, and it gets inside, and that causes the pain and inflammation. And so it's a lot to do with the breakdown products. So, for example, if you take it intranasally, it tends to be worse than if you take it orally. So the mode in which people take it can also affect how that ketamine is processed.
Thank you. So the most common question we received, and the first question we'll be starting with today, was, will my bladder recover? If you could provide some insight into this question and ideally some hope, that would be amazing. Thank you.
Yeah, I think for most people, if they stop, the bladder will recover. And so it kind of relates to how long you've been doing it for, really. For most people, if they've been taking ketamine for a year or so and they stop, for most people, the bladder tends to recover. And it's also related not just to time, how much you're taking and what dose you're taking and for how long you're taking it kind of determines if you are going to have recovery. But I'd say for anyone who stops ketamine, that's actually a positive. There will be some recovery. And so what we've noticed is people who've taken it for a long time and they've damaged the ureters, which is the tubing that affects joins the kidney to the bladder. And there's been cases where they've stopped it and actually over time things have improved. And I say for the majority of people, stopping ketamine, would lead to recovery of the bladder. And that's probably the single most important step, really, to deal with ketamine bladder and the associated factors. And even for those where, anyone who stops the ketamine, the pain will improve. And so that will take a bit of time, but generally speaking, the pain will improve and then things will stabilize out. And there are treatments that we have which can ameliorate some of the problems that you have. And only a tiny proportion of patients will need reconstructive surgery. So even if you stop and the bladder doesn't fully recover, there are surgical options that we can improve things for you.
Yeah, that's great to hear from you, Mo. I see that firsthand. A lot of people come into our group and then recover, and sometimes within a matter of weeks, sometimes it's months, their bladder will heal quite miraculously. But there seems to be this thing, I think, because people hear permanent damage, they assume when they've got to a certain state that's it. So yeah, it's really good to hear that. Thank you. Are you able to give us an overview of the kind of treatments you currently perform for those suffering with ketamine bladder syndrome?
Yeah, I think the most important thing in terms of the treatment is actually stopping the ketamine. And so first things can be conservative measures, such as reducing tea, coffee, acidic type foods. Then there's more simple things. For example, if you go more often, there's tablets available, such as anticholinergics or beta-3 agonists, and what they do is calm the bladder down. And so if people are going too often, that can help in terms of reducing the frequency. In terms of after that, you can use, for example, Elmeron, which is like an oral tablet. What it does is it realigns the bladder. And so, as I kind of said about the bladder, it needed to be waterproof. It takes a bit of time and realigns it, and people get, improvement with that. Following on from that, you can then do installations to the bladder called gag layers. So the gag layers, if you like, make the bladder waterproof again. And for some people, we can give Botox to the bladder as well. In terms of the pain management, it's simple analgesics, amitriptyline, gabapentin can help in terms of that side of things as well. And so after that, it tends to be more things that are reconstruction depending on that. And if you imagine it's like a pyramid, the majority of people can be managed by those sort of measures as well to allow the bladder to recover itself. And the minority of people will then require further things such as making the bladder bigger or potentially giving a stoma. And those tend to be more the severe cases. So that's pretty much more the tip of the iceberg.
Thanks. Just curious, does the Botox tend to be then like a secondary treatment? Say if the the installations haven't been successful, or
Yeah,
how
well,
do
you
you
can combine.
decide?
Yeah, you can combine it, but it kind of depends what the component is. If it's an overactive bladder, because of the bladder become very thickened and so on, and a proportion of patients can have Botox. The downside of the Botox is that it wears off after about 6 months. So generally speaking, it's only in a select cohort of people, select number of people. So it's a case by case basis, and so that's why it's about, I think it's about finding out, from the patient what's important to them and what they're prepared to take, and how far. For some people, for example, doing the bladder installations can be very challenging because they don't want. What tends to happen is that someone, the nurse will put a catheter in, put the installation in, they keep it for as long as they can, and then you do it for a weekly basis. Then it weans off to once a month, and then for some people that can be a challenge. And there's, for some people, the Almiron, it's an oral tablet, but it takes several months for it to kick in. And so you have to be patient with the treatment. So we will try and find something that the patient finds acceptable. So similarly with the Botox, in that case, normally we would do this under local, but with patients with ketamine bladder, if we were to decide to do it, we would actually do it under general anesthetic because we understand how difficult it is.
Mm. And the BAUS guidelines that you authored recommend a 6-month sobriety requirement before any surgical procedures. Could you explain why this is important?
Sure. So if you imagine all that treatment I've mentioned, apart from the surgery, you can have all that treatment without stopping for 6 months. Because part of the problem is, if you do all that other treatment without surgery, as in the surgery we're going to talk about shortly, by taking the ketamine, you're kind of fighting against the treatment. Now, with the surgery itself, it's major surgery, such as making the bladder bigger or replacing the tubing between the kidney and the bladder. If people are still taking it, then it's like a roadmap. And what happens is you do the operation, but if they're still taking it, the damage will go further up and they'll need further surgery as well. And that's the danger. And so by having 6 months stopping it, then you can make the bladder bigger using bowel, because what we found out is that if people don't stop and they're still taking it, then actually the surgery won't be as successful because you kind of making the damage worse on the parts that you've not joined up, if you like.
Yeah.
So if you imagine from the kidney to the bladder, you've made the bladder bigger, but you keep on taking, you damage the ureter, then actually you'll need further major surgery. And so our thought is really all about what's best for the patient, and we prefer just to do the one major operation to try and fix their problems.
Mm-hmm.
But by taking it, you can potentially make things worse and end up requiring multiple operations as opposed to a single operation.
Yeah, it's unfortunately something that I've seen too many times. People having surgeries that are still using that just maybe haven't been honest. And then, like you say, it's unsuccessful, and then they're often looking at next steps when, in fact, a lot of it seems to be acute and would probably be fine in a few months if they've recovered, and they'd have a better chance at the surgeries.
Well, exactly. We want the best for the patient, and and I think with surgeries, the first surgery is always the best surgery, broad principles, and redo surgery is always more difficult, and the success is not necessarily guaranteed.
Yeah.
I mean, it is a frustrating part, and I see a lot of frustration from the patients, and I totally understand. 6 months seems to be a long time, but equally, the surgery is, it's actually major surgery. It's not straightforward surgery, and so that's where the problems can lie. I mean, like I said, the other treatments that are available, the installations, the Almiron, then you don't necessarily have that 6-month thing. It's only for the major surgery.
Mm. And how do you know when it's too late to save a bladder?
I don't think it's ever too late to save the bladder. I mean, you can live in a very small bladder. It's about trying to work out what's important to the patient. So, for example, sometimes if pain is a real issue and the bladder is very small and the patient's happy to have a stoma, then we would then take the bladder out because it's a source of pain and discomfort. But generally speaking, I'd say that if the patients are keen to keep the bladder, we can keep the bladder and use a bit of small bowel to make a new bladder for them on top of that. So again, it tends to be driven individually according to what the patient's desires are, what they want. So, for example, we'll have patients who are adamant they don't want a stoma, then we would then either use the tiny bit of bladder and put bowel on to make new bladder, because especially for men, it keeps the nerves for the erections going and so on. And so, and sometimes, you can have a bag but leave the bladder in because, that adds to the complexity of the operation. So I'd say that it's never really too late, that you can always keep the bladder, but it's a matter of working out, what's important to the patient.
Yeah, thank you. This was a question that we had a few times, and I've seen it quite a few times in the groups as well. I think it's quite a concern for a lot of people. So, will a bladder damaged by ketamine now age faster? And if so, is there anything we can do to extend its lifespan?
Yeah, so I don't think it'd age faster. I mean, I think what tends to happen is once you've stopped the ketamine, all that inflammation stops. So it stays the same. As all people get older, the bladder capacity does reduce over time. So that's all that happens. It doesn't necessarily age. So, for example, most people as they get older, generally speaking, their bladder capacity does reduce over time. But we're talking, if 60s, 70s, 80s, so it's some time away. I think, per se, I don't think it necessarily will age the bladder. It just means that your bladder capacity may be slightly less than a person, but we get a huge range. So the analogous is we see lots of patients with cystitis where there's inflammation of an unknown cause. And so what we notice is that they probably go a little bit more often. So most people will go more often as they age. And that's just a natural process. But I don't think per se it will make it age faster. It's just that your starting bladder capacity is going to be slightly less.
Yeah. Okay. Now, bearing in mind that a lot of people affected by this do have a reduced bladder capacity, could you provide some hydration guidelines for someone with ketamine bladder?
It's a fine line because on the one hand, if you run yourself dry, it concentrates the urine. But equally, if you drink more, then you're going to go more often. So there's a healthy balance, probably about a litre, I would say. And most food has water in it. So an excessive amount of fluid is not going to help you because you're just going to go more often. And it's this perception that maintaining a high fluid intake will make things better. It's not necessarily the case. It just means your life will be a lot more miserable going too often. Equally, if you do the opposite and you don't drink enough, then it concentrates the urine, and that's probably not good too because it may worsen some of the symptoms. So it's trying to find that happy medium. It's not just hydration; it's also food's really important, and so it's best to avoid acidic foods. So things with tomatoes, try and maybe go more on an alkaline diet because everything you eat, will be excreted. So remember, urine's an excretory product. So I think it's important to not just in terms of hydration, it's avoiding spicy food and things like that can exacerbate things. So it's not just the water itself.
Yeah, I found that to be very important. Some people are a lot more sensitive than others, and even like a tomato can trigger a flare up lasting hours. So yeah, definitely big on the diet. I found that through looking at interstitial cystitis actually, because it was such a similar condition and there was already a lot of information out there. So yeah,
That's right. And that's right, Mason. I think you can use that bladder bowel and things people do for intercystitis. Whereas intercystitis is a similar sort of process, but it's lots of different causes or unknown causes. Whereas the ketamine bladder ends up being like intercystitis at a certain stage. And so you can use those sort of dietary things which will help you.
Brilliant. And if we could talk about nerve pain. So I see a lot of people that are experiencing nerve pain, and it seems to be one of the most frustrating conditions because it can affect other parts of the body. It's one of the most intense types of pains and seems to be one of the hardest to treat as well. Is there what does a the treatment or recovery look like for people experiencing nerve pain from the bladder?
Yeah, and so I mean, in a way, you've got to describe why you get nerve pain. And so, the bladder's main function is fill it empty, at the right time. As the bladder fills up, you get nerves or sensory nerves, which give that information up to the brain. And then once it reaches a certain size, then there's like a switch higher up in the pontine micturition center, which would allow you to void. But you need the higher centers, obviously, if you don't want to go for a wee anywhere. Now, those same sensory nerve fibers, which look at how big the bladder is, are also affected by inflammation. So what tends to happen then is there's inflammation, and that's then perceived via these sensory nerves in your brain as pain. And what happens with ketamine and taking ketamine a lot of the time is you're going through all these periods of inflammation and pain. And the nerves normally, it happens anywhere in the body. If you've got constant inflammation, even if inflammation starts to go down, those nerves are hypersensitive, meaning that they've constantly been stimulated, and so they're heightened in terms of pain and perception of what's going on. And that's what happens with ketamine bladder. Is then that's why that pain, it can be an issue. And then when you get pain there, then there's the pelvic floor and there's the associated organs nearby, and they can, everything becomes tense, the muscles become tense, and that's what causes that plain thing, severe pain. But once you stop the ketamine, and over time that will dampen down, the nerves will become less sensitive, but it takes time. And so the things are, obviously, the main thing is to stop the ketamine. Simple analgesics can help, non-steroidals can help, ibuprofen, these things. But what you probably need is a neuropathic medication. And that can help as well. That has its own problems as well. But, classically, you can take a little bit of amitriptyline, which dampen things down, or gabapentin or pregabalin, and for a period of time just to calm things down for you. That's a critical time, because what happens is you've got severe pain, and then you take the ketamine because it gives you that temporary relief. But it's actually worsening the situation. It's a horrible feedback, and it's breaking that cycle. And one of the problems really is trying to get on top of that pain and having access to pain management as well, and having a responsive pain management team to try and find what's going to help you. And sometimes even duloxetine can help. So that will dampen down the hypersensitive nerves. But if you stop the ketamine, simple analgesics or even cocodamol can help for a period of time while you bridge that gap. But it's a difficult point because, say, for example, you take lots of codeine or even tramadol, then there's a risk of you being addicted. So there's like a window in which you take the pain relief to dampen things down, all these sort of pregabalin and amitriptyline, dampen them down. Then you need to wean off those painkillers, or else people can get addicted to the opioid type medication. And that's where the difficult part comes. And I think that's where I think the management of ketamine has been frustrating, is we need more of a buy-in with the pain management services.
Yeah, that's it, because that's where people are getting stuck in this cycle often of just taking more ketamine because it's the only thing that can help a lot of people, or it seems to be. Sometimes they aren't prescribed drugs like gabapentin or pregabalin because of their predisposition to addictive drug behaviours. I'd just like to ask, actually, so I recommend box breathing quite a lot recently after speaking to a pelvic floor physio, and see a lot of benefits for nerve pain with that. And also recently discovered that the pelvic floor becomes like hypertonic because of the chronic pain of the bladder, which exacerbates this nerve pain and all the kind of associated organs as well. Do you ever refer people to pelvic floor physios, or do you have any kind of recommendations for people going to visit them?
Yeah, I mean, I think it can help. The problem's access to the pelvic floor physio, because it'll help once you're on that journey where you've stopped the ketamine and you're on the recovery part. Part of the problem tends to be if you're still taking, then people tend not to attend, and it's actually difficult accessing that pelvic floor. But that hyper aspect has to be after you stop the ketamine and you're in that window of trying to recover, and it does make a difference, and trying to relax that pelvic floor.
Yeah, thank you. Now the next question was asked a few times. So why do periods make my bladder worse?
It's to do with hormonal changes. So we see this all the time. And so if you imagine that it's to do with the estrogen progesterone, and it's quite common, most people with bladder symptoms in women, for whatever reason, they have the similar sort of thing. And so it's actually hormonal changes. But it's not that well studied in ketamine, but it's similar to cystitis and so on. And what tends to happen is that the hormones change the perception of the pain and the cycle as well. And so it's pretty much hormone related, and it's actually quite a common thing. It's preternatural part of what happens in women's cycles, unfortunately.
Oh, thanks, Mo. Now we see a lot of people using natural supplements. One of them is there's a specific aloe vera tablet by a brand called Desert Harvest, and it contains the aloe vera contains this compound that's structurally the same apparently as the bladder lining, the gag layer, and that works really brilliantly. Just wondering, are there any supplements that you recommend?
Yeah, I mean, I think probably the supplements tend to be in general terms. It's very difficult to know, what the quality of those supplements is, and there tends to be variation in how different supplements are prepared. And so they've done studies of supplements, and what they found is actually the percentage of supplement within that is actually pretty low. And that's actually kind of the problem, is because there'd be a big variation in how you do. One of the things I would recommend would be magnesium. And having said that, again, the supplements vary. And the reason the magnesium is it calms the bladder down, and it's a bit of a muscle relaxer, and may help reduce the pain relief. And so actually magnesium supplementation would be really helpful. As long as you take it regularly, perhaps taking it in the evening just to help you sleep. And also magnesium tends to stabilize those receptors. And so it's not going to help in terms of the pain, but it may reduce the amount of pain relief you need. But you need to take it regularly, and you need to find a magnesium supplement which has sufficient. But if you take it on a regular basis, it should help as an alternative supplement. But again, a lot of the evidence for the supplements is somewhat limited because it's not been studied. But magnesium per se, will help in terms of it's shown to sort of a bit of a muscle relaxant, and can reduce the amount of pain relief that's required.
Brilliant, thank you. Do you have anything you wanted to add before we kind of open the questions?
Yeah, I mean, the thing to really say is it's not that single person. It's a family support. It's that whole system, and I think it can be rather frustrating for parents, and and my kind of thing is really prevention is better than the cure, and it's about getting that message out there. There's obviously people who've got ketamine issues. I think there's like a flood, if you like. There's a 2-year gap, 1 to 2 year gap before we see patients. We tend to see only the extreme end of patients because they've been doing it out in the community, and therefore it's going to continue to peak, and then it'll come down. But therefore, I think the most important thing is really for everyone on this call. I'm sure they do tell their friends and families the importance of not taking ketamine, especially the young people. And you've got, for example, children who are, from the age of 12 onwards taking ketamine, which is really tragic. And so I think we all have, it's important that we all try and get the message about the dangers of ketamine. And we've tried our very best, but it's just accessing the right people, the schools, colleges, universities, nightclubs. And so, within your group, it's really important to get the message out there because, and I think that's good that you've got that WhatsApp group, because it's really important to try and get that on social media about the dangers of ketamine, because that will prevent people ending in this difficult situation.
Mm. Yeah, I agree with the prevention being the best way, and I'm glad it's starting to get a bit of kind of media attention now, and people are talking about it on social media, and a lot of people are like the older generation of ketamine users around my age are now discussing like stopping, and it's not as like fashionable to us as it was. But yeah, still unfortunately huge amongst young people, and I really hope that more schools kind of take this on board now, and start to update the information that's being given. I think a lot of the information on ketamine that's being done in schools is unfortunately still the same stuff that was done years ago, and they're not quite grasping the severity of the situation, and there needs to be a bit more of a focus given that it's such a popular problem at the minute.
I mean, the only thing you say, the government has recognised that, they went through the classification. It used to be categorized as C, then it was B, and they were thinking about making it into A. But actually, the positive aspect of that is they've recognised that in the different components of research, awareness and so on. So hopefully, I think, for the parents of ketamine users, it's really important to write to MPs and to politicians and to try and get that awareness out there and to try and get the pressure from above in terms of, having financial investment in like integrated systems. And that's one of the key things, is really, that's the only way I think we can help in the long term, is just to get that great investment into this.
Mm. Thank you, Mo. So I'm going to open the chat now. If you have a question you would like to ask Mo, please write in the chat. And then Mo, if you would like to select any questions you would like to answer.
So in terms of the magnesium per se, there's lots of different magnesiums, but it doesn't really matter which one you go for. There's lots of different, as long as it's taking it regularly. I think that's the most important thing, really. And so I wouldn't get too hung up about the different types, but that's the main problem. Supplements is the quality, and even the ones which are well used. Actually, they've done experiments where they've taken the stuff out, and what they've realised is there's not that much magnesium. But I think any magnesium supplementation would be helpful. Yeah, so part of the problem is this question about by the time the period is sort of jelly-like substance. Again, we see a lot of that, and again, that jelly-like substance is actually the stripping of the bladder, and so it's like the hormonal changes means that part of the cycle sometimes you will get that kind of jelly thing, and people who take a lot of ketamine, that's like if like you get this sort of I suppose it is the probably top end lining of that. But it's also with hormone changes, you get more discharge or more mucus formed as well. And I think that would be the case. You can take amitriptyline and gabapentin together, but again, I think it's about the main problem with taking amitriptyline and gabapentin and with all those sort of drugs is that people can find it very difficult to wean off it. And so again, it tends to be under the supervision of, the pain specialist, and they can help guide in terms of taking those together. I'll come back to the ureter reimplantation surgery. Buscopan can help, and that's because the effects of the ketamine is not just on the bladder, it affects the gut. You get those K cramps as well. And one of the things I've not actually mentioned is one of the big problems of ketamine is not just the bladder, it's the liver. And it affects the tubing which connects the gallbladder to the bowel. And you can get significant liver problems and liver disease from that, where it damages the liver because the drainage of the bile is affected the same way the ureter gets affected. In terms of the ureter side, the ureter side tends to be the more severe. For most people, it tends to affect the bladder, but the ones who've taken it for a very long time, it will affect the ureter. And so that surgery, we do that surgery as well. And that's where the 6 months being off is really important, because if they're still taking it while you're going to do the surgery, and just do the surgery on the bladder, if it affects the ureter, then it's more of a problem, because it depends how far it scars up. If it scars up very high, then it complicates the surgery quite significantly. Someone's magnesium, that's fine. Uh, I don't think in terms of ketamine affecting pregnancy per se. If you've stopped the ketamine, it probably shouldn't affect the future pregnancy, but you may find that during pregnancy, with the womb enlarging, that your capacity might reduce and you might have a bit more pressure. Yeah, so there's a question about using different drugs as well, and so yeah, I mean generally speaking, if you're combining different drugs as well, it probably does potentially make it a bit worse as well, and you do tend to get more problems when you do poly, and it's quite common for people to not just to take ketamine, they take it with cocaine and take it with other things as well. I mean, the question about pregabalin again, it's about the problem with pregabalin and gabapentin and amitriptyline is the risk of addiction to it. Less so probably with the amitriptyline, more so with the gabapentin and pregabalin, and it can be difficult to wean off. And again, it's about having that sort of shared decision with the doctor. And if it's a general practitioner tend to be quite reluctant, then it's worth trying to get referred to a pain specialist who can try and help you with regard to that. So someone's written, passing jelly mucus, what is this? Again, sometimes it's the bladder trying to recover. And if you've stopped it, over time that will settle down. And unfortunately, when people are still taking it, sadly, you can have visible blood in your urine and bits coming out, and that's kind of like, if you like, you're stripping out the inner lining of the bladder. So in terms of, I mean, you still going too often. Again, you've got to ensure that you change your diet, you reduce your fluid intake to maybe a liter. In that sort of situation, the things that can help, for example, would be things like Botox. But again, it depends on that individual thing. This is for one of the questions. So you can try a combination of the solifenacin background or Viagra, a new one. So what they've shown is solifenacin plus Viagra works better than each of them individually. So combination may help. And then in that case, blood instillation, so Elmeron may help as well, try and calm things down. Um, so So the person who's trying to push through, it's because of the pain, because people feel that if the bladder's empty, the pain will be less and becomes a behavioral thing. And then people push and strain, and that could cause more bleeding and more pain as well. And again, it's a lot to do with then still taking the ketamine, and it's pretty awful really to see people in that situation. But again, it comes down to trying to give up the ketamine really. Um, Water stretching doesn't really stretch the bladder, it just makes it more painful. So the way to look at it is that there's inflammation going on, and it's a bit like when you cut your finger. It has to go through a certain process. By overstretching it, it's actually not good for the bladder. And so, sometimes in other things apart from ketamine, we can see over distension injuries from that. So, drinking lots of water doesn't really stretch it. It's just making you go more often, and trying to do that, for example. And if the bladder capacity is a certain amount, trying to overstretch it actually causes more pain. And it's definitely not recommended. Yeah, so again, combinations of different types of things. The problem is it reaches a point, if you do stop the ketamine, it's about patience that things will get better. It's why I mentioned about those nerves are hypersensitive. If you imagine, they're like guards waiting there because something's happened. And so any little perception will be perceived as pain. And that will over time get better. And sometimes it's really frustrating because it just takes a bit of time for that. Um, with inflammation, the bladder can improve over time, and so with inflammation, sometimes taking the Almiron, can help. And over time, it's still 130. Then over time, it can still stabilize at 130, but then sometimes giving Botox can increase the capacity as well. And then if it becomes a problem, you can make the bladder bigger using bowel, and that's called an augmentation cystoplasty. Yeah, so the constipation, if you are constipated, it will affect the bladder, and having to strain is not a good thing, really. And so, if you are constipated, it's really important to have enough fluid, but also enough laxatives as well. And so, it's really important that the diet's also important. So, even for example, not just talking about ketamine, people can get retention when they're very constipated. So, straining is not good because you will get more bleeding. Yeah, so the suprapubic again, I think the difficulty is once you've got a catheter in, it's a foreign body, and you get inflammation and lots of infections as well. And so long-term suprapubic is not really a solution in a young person. And again, it kind of depends individually. You tend to have a test called urodynamics, which is not pleasant, but it looks at the function of the bladder and will give us an idea in terms of what the treatment options are. And so each treatment option is based on what's important to you, um, and what things you're prepared to accept or not accept. Whether you're happy to accept a stoma or not happy to accept. So there's lots of different surgeries you can do. We would try and find a bespoke solution for you based on your preferences, but also what you're prepared to accept and not accept. And so the capacity being low, you can still make the bladder bigger using bowel, or if the pain's a big issue, then you may be better off having a stoma and then having the bladder removed, if you've stopped the ketamine. The part of the problem we tend to have is that people still keep on taking it, and that's where the problems worsen, and then they start getting other issues as well. Per se, you can't really strengthen your bladder per se, apart from stopping the ketamine and stopping it for some time, and there will be some recovery of the bladder over time. Both that's all but a question. So, I mean, retraining, you can do, so generally speaking, you can retrain the bladder once you've stopped the ketamine, and it works better if you're taking the medication such as solifenacin, viabegron, merobegron, and that's been shown to work better. So if you're trying to retrain it, it's probably worth taking those tablets to calm things down a bit, and then doing it gradually. And there's a set way to do it, and you do it very gradually over time, and you can increase the capacity over time. In terms of male to female, what I would say is that there's actually been two ways of ketamine bladder. But the first time I saw ketamine bladder was back in 2007. I remember seeing this young man came in with blood in his urine, looked inside, it was all inflamed. And I still remember him telling me, "Oh yeah, I'm taking ketamine." I'm like, "Yeah." And and actually that was the first time I ever saw someone with ketamine bladder. And so the first wave was in the late 40s, early 10s, and as the drug became less popular, that kind of settled down. In that first wave is predominantly more males than females, but in the second wave, it's actually probably more 50-50. So we see a lot more women with that. In terms of the gender per se doesn't affect it, it's more how you take it, what dose you're taking it, how long you're taking it. And part of the problem is also the contamination of the ketamine. You're not likely to get pure ketamine as well. And so what's more important is how many grams you're taking and how long you've been taking it for. And you'll be surprised about, crazy amounts. We had this one person in who took 21 days, 29 grams in one sitting. Unbelievable. Yeah. And, so that's probably more important. Even if you've taken it for 5 years and you've taken large doses, there will be some recovery in the bladder. The recovery will be less, but there will definitely be recovery because the inflammation will reduce and it'll give bladder time. Bladder is a very special structure in that it has a very good blood supply, and it can recover. And even if you're taking it for 5 years, stopping it, actually there'll be some recovery, but actually will allow you to then consider surgery to try and make the bladder bigger and improve your quality of life. In terms of pregnancy per se, again, it's a lot of hormone changes as well, and it's also it's always difficult to know from pregnancy to pregnancy, but it's also about your diet as well, and so it's not that well studied in pregnancy per se. Naproxen can help. It's a longer lasting non-steroidal, which lasts about 12 hours. In America, you can get over the counter. In the UK, it has to be prescribed. The downside of naproxen is it can cause you gut problems. So you may need to take Gaviscon or omeprazole or proton pump inhibitor to reduce. Some people can get gut ache with naproxen. The mucus, if you like, the mucus is the body reacting towards inflammation as well. And so that tends to be something which will vary according to individual patient, what you've eaten. That can also affect that as well. You might potentially, if the person with a gabapentin, you may potentially try amitriptyline or duloxetine. But again, you'd have to see the pain specialist or your GP with regard to that. Burning when you urinate is actually a difficult problem, not just in ketamine. And a lot of it is to do with the acidity. So again, it tends to be sort of dietary related as well, because all the waste products are produced in the urine. And so diet, perhaps having an alkaline diet can help. Yeah, so obviously it's quite common when people do pass with ketamine blood and they're screened because it's a physical, like, lining being inflamed and the body's reacting and you're stripping that away, and that can get better over time. Again, it unfortunately comes down to stopping the ketamine, and that will improve over time. Um, The bowel, unfortunately, can have an effect. It's called K-cramps, and it's actually the ketamine itself affects the bowel. The bowel pain, the buscopan may initially help, but again, you may need to restrict your diet to sort of more simple diet. Sometimes it can affect the gut flora, and the gut flora is really important. And so, taking some probiotics can help with your gut, and that can help some of the pain. But again, a lot of it tends to be related to the ingestion when you're taking the ketamine. So I think the gut is quite common. Shooting the leg pain down the leg. Again, it's probably nerve related, and that would be more sciatic type pain. So if the bladder's very inflamed, what tends to happen, the nerves, sort of around the bladder tend to go down into the genitalia, but sometimes you can get effects of shooting pain further up, and that's probably a secondary thing of the way the nervous system works. And again, it may be to do with nutritional issues, and so it's really important. B12, folate, those things. What tends to happen with people with ketamine, they stop eating, the nutrition's really bad. So probably multivitamins may help as well, because you do get sort of deficiencies because a lot of patients on ketamine lose muscle bulk, they're not eating well, and I think that's important in terms of ensuring that you do take some multivitamins that you can tolerate. Yeah, so the question about does the bladder work when you have nephrostomies fitted? Yeah, the bladder can recover as well. And in fact, the tubing between the kidney and the bladder can recover. And we've seen instances where it has been really inflamed and then over a period of several months, up to a year, things have improved spontaneously. So someone's about the consultation with the scan. The scan's really important because the first scan's really important because it looks at the kidneys and makes sure the kidneys aren't dilated. And urine tests to exclude infection. So if you do get infection, your symptoms would get worse. Someone's written about dehydration causing UTIs. That's very true. And that's why you've got to find the optimal amount. Now, the pelvic floor irritation causing painful ejaculations, again, that's more of the pelvic floor syndrome. And again, that can help if you have that specific problem, and that's like called prostatitis. And that's probably because, again, you've got the ketamine going through the system causing inflammation. I think we talked about the supplementation. I mean, it's difficult to know about supplementation for the reasons I've mentioned, but certainly I think magnesium would be helpful, multivitamins would be helpful, and your diet's going to be important as well. And I think there's a lot of patients probably have nutritional deficiencies because they're not eating well, and they're in a lot of pain. And so I think that's probably more important. Yeah, so if you've been taking it for a very long time, a lot of it may relate to the pelvic floor, and so because the way you learned, if you want to void, you have to relax your pelvic floor. You have to relax your sphincter as well, and if you don't relax your pelvic floor, you're pushing against it, and therefore you have to really push hard because you can't relax your pelvic floor. And actually, what Mason said about pelvic floor physiotherapy might be useful in that situation. It's very difficult to find about local data on ketamine bladder because we only ever see the worst end. So the only way you can surmise it is from the ketamine use, and they do these urine samples and sewage to work out what the use of ketamine is. I think it's slightly turned downwards recently in the last year or so. Perineum area, again, it could be the pelvic floor. If it's a man, it could be the prostate as well, because and that and the perineum is classically more the pelvic floor stroke prostate in a man. Yeah, there's a question about opioid addiction as well. I mean, that's a difficult one because, again, the young teenagers. It's a tough situation, and sadly, there is a gap, and that's something which I think needs a bigger picture in terms of trying to sort that out. And so, that's why the pain team tends to be reluctant to give you opioids for that, because you convert one to another, or even you end up with two addictions, in terms of the ketamine addiction and the opioid addiction. And we do see that in the extreme end. Same question about the bladder being stretched. Again, I think I've mentioned about changing your diet, trying a combination of solifenacine and Begron, going back to see your urologist to see if there's any other treatments they can do. They might have to do further tests, such as urodynamics, which may help. So the blood can be related about UTIs and bladder infections are pretty common because you strip the lining of the bladder, and so that means that the infection can get in. So this gag layer, this protective layer, which keeps it waterproof, also prevents bacteria from going in. So it's quite common that you do get that. And then the bleeding is your body reacting to the severe inflammation. Yeah, I mean, the ketamine does affect the executive functioning. It's more the addiction, really. It changes the way you perceive things. And so that tends to be the problem, really, is that, and that's why it's really important to have that peer support. And I think that's where it's really important that, Mason having a WhatsApp group, that peer support makes a big difference, and that you can then sense what you're thinking and so on.
If you want to answer one more question, Mo, and then we'll wrap it up.
There's some question about America. America, unfortunately, I don't know. I do get sort of emails, America, Canada, and so on, and it's not that well known. But actually, most of them, if they're treated like cystitis, as long as you stop the ketamine, they should be able to help. You probably have to go to one of the more main centres, and really, you need to see a functional urologist, someone who has an interest in it, will be able to do that. So the analogous would be people who have an interest in cystitis should be able to help. Yeah, Botox didn't work. I think that's. I'm just going to run through if there's anything else which we've not touched on. I think. Yeah, I think that. Okay, so I think we'll probably stop it here. So.
Okay. Yeah, thank you very much, and a special thank you to Abby for helping out, and to anyone who's attended, just to better educate themselves. And I hope it's been a really informative session. Anyone whose questions didn't get answered, I think me and Abby will try our best to. There were still some questions in the survey that we haven't managed to put forward. Me and Abby will try our best to answer those on social media. If you want to get in touch with me, you can find me on LinkedIn, or if you go to the recgroup.org, you can find my email address there, or if you want to join our WhatsApp community, the link is on there. And this session will be uploaded to YouTube at some point, and it should be emailed out, so keep an eye out. Yeah, thank you very much. Thank you, Mo. I really appreciate your time.
My pleasure. Thank you for the opportunity.